My name's Randy Williams, and I'm also from Shadyside, Maryland. And I went to the elementary school the first year it opened, and my daughter went to that school. So I have my heart with that school, and I decided that I really needed to be part of this coalition to fight the cell tower. I'm also a registered nurse, and I'm a bereaved parent. So I have a lot of issues with people that don't care about our children. The American Academy of Pediatrics stated in a letter to the FCC, I think it was in 2013, that children are not little adults and are disproportionately impacted by all environmental exposures. This means the air that they breathe, the food that they eat, the dangerous chemicals they're exposed to, such as lead or paint, and it means exposure to radio frequency electromagnetic fields, of course. Children's exposure to radioactive frequencies now starts preconception, as the father sticks his cell phone in his pocket and it exposes his sperm to changes in the DNA. I've learned by reading a lot of information recently. The mother of the mother-to-be carries her baby and her inner uterus, and she sticks her cell phone right next to her baby, and she might do that for hours, talking on the phone, resting while she's pregnant. As a recovery room nurse, my pediatric patients are distracted and lulled to sleep by their parents with their cell phones, sometimes like inches to their body. I'm always telling them, please put that away. But that's the reality that I see. The risk of further exposure due to cell towers next to a school playground or a school ball field is scary, and it's not safe. And we're not going to see those long-term effects for possibly years, maybe sooner. We don't know. Since I became a recovery room nurse in 2004, and myself and my coworkers have noticed an incredible increase in the rate of autism and other issues such as ADHD. And we're always wondering why is that going on? So the exposure of the radiation is leading to changes in the DNA, and this is what is being seen as a result, and that's being shown in the studies that the other folks have talked about today. So in closing, I just want to say that I know as a nurse, my biggest concern is our health, and our health means our futures. And the biggest public health crisis is going to be occurring in our children. And it's going to impact the children, the parents, the educators, the school budgets, the pediatric hospitals, and our community-based special education programs. Where are they going to get the money to take care of all these children with autism and other special needs? So we really need to pass some laws and for cell phone safety, and we need to get cell towers away from our children's schools. Thank you.